Hey guys, it's me. It's Dr. D. I'm currently having one of those days where you just have this like random hair that doesn't want to obey. What a jerk. Anyway, I'm here. We're gonna do some Reddit stuff. Lots of people on the internet looking for some kind of medical advice, and I'm here to give it to you. So, boom, here we go. All right. So first we have on lovely Reddit back pain. We have lower back pain. Aptly named. I've had lower back pain for about 3-ish years now. I've went to doctors, they have done x-rays and more and said it's more of my weight, but I don't think it's so bad. But I don't think so. It gets so bad to the point where I can barely stand up and doctors have just said to lose weight. But again, I don't think so. Also, it just started to go to my leg, but I can barely feel it. Also, when it started, I went to a chiropractor and she did adjustments. The pain went away and it came back. Anyone going or gone through this? Well, I can truthfully say that some people have definitely gone through some back pain. Back pain is one of those, low back pain especially, is one of those just things that have affected just so many people, and it's a really big issue in America especially. I will say that weight definitely is a factor in that kind of stuff, but it's interesting to know that when you got adjusted that it immediately, well, maybe not immediately, I don't have full context on it, but it did go away, which I find is obviously a very, very good sign. When patients come in for me specifically and they are complaining of some kind of low back pain, I'm always looking at what their mechanism might be, which is, does it hurt when you sit? Does it hurt when you stand? Does it hurt when you jump? Does it hurt when you cough? And a lot of that stuff will give you backup. It'll give you like an idea of like what again, what I like to call the mechanism, like the thing that specifically is causing the pain. Because the back, there's a lot of stuff going on in the back. There's muscles and fat, and then there's like discs and joints and blah blah blah, and all these things can combine to make a very, I guess, convoluted environment. And I do think that weight is definitely a factor, but it's interesting to me to think about, well, if it's your weight, what happens when you go into a position where your weight's not necessarily a factor? So, like, if you lay on your back, you're not fighting against gravity because you have to think about the way the spine is shaped. I'm sure I'm going to put up a picture of it here in a second. But when you think about why we have spines, our spine is made to fight gravity. And whenever you have the load of gravity on it, if it hurts worse, that means that the straight down pressure of it is going to cause you to notice that pain. Now, if you go to a doctor and MDs and or chiropractors, I love both of us. I will say that if you go to an MD and they are telling you that a weight's a factor, it probably is. That's why we have a BMI. But is it what I like to call a death sentence? No, I don't necessarily think so. I do think that losing weight, you'll definitely feel better for a variety of reasons, especially if you feel it in the knees. Is it the only thing that can be causing your problem? No, there's probably other lifestyle factors. Again, we don't know this person's job. We don't know their lifestyle. We don't know what they eat on a daily basis. But I will say that weight is definitely a huge factor in it. Is it the only thing? What I will say is that if you came to me personally, I would say do these movements or whatever, right? And if we could find a very specific position or movement that causes that pain to get worse, or at least like what I like to call the pain recreation, then I know that we're onto something. But if you're starting to feel the pain going into your leg, I definitely think you need to get it handled. A true sciatica is pretty miserable, but if it's just referring into the back of the leg, in my opinion, I've seen a lot of people come in and claim that they have sciatica, but it's usually a tight hamstring more often than not. But if it's a true referral where you have the nerve going down into the back of your leg, yeah, that's not a great sign, and you're going to be in for a real bad time if that doesn't get handled pretty soon. So, like I said, I don't think that weight is the only cause for something like this, but again, it is definitely a factor. We have an obesity epidemic in America. It's just kind of the way it is. It's usually caused by the SAD. You got to love the old SAD, SAD, standard American diet. But I don't think that you are doomed by any means. It's just something that we have to manage. And, if you go to a good doctor, they're going to teach you that kind of stuff. So let's start going to comments. So we have, what means barely feel it? As long as you have only pain, you are fine. I don't know about that. Pain's a pretty debilitating factor. We can work it out, or somebody, I'm not an MD, but numbness or tingling is a warning sign that needs immediate attention by a psychiatrist or a surgeon. Not necessarily, you don't have to necessarily go straight to a surgeon. I don't know if that's exactly where I would go first step. Which adjustments did your chiro do? Pain went away and no tingling or numbness. Temporary can happen, but at least he got it right short term. Very important to know what exactly he or she did. That's true. Obviously, when you go over like medical stuff, I'm never going to judge anybody. It's hard to give a full picture because you don't know all the information. But that's actually a really good point. Let's just say that this person came in and got what we call like a side posture. If you got a side posture done, that's a really big movement in the lumbar spine and in the sacrum, and even a little bit of lower thoracics in a lot of way. And if you notice that helps, it tells you that there might be more of like what I call a little rotatory component in the low back, which is fine. That's still very manageable, but it tells you that if you go into a different direction, it might make it worse, at least temporarily until the body can fix it. But that's actually a really good point. By the way, forget the obesity argument. It's hogwash. Yeah, see, there you go. Hogwash depends on how obese you are, of course. Yeah, I will say, like I said, I have noticed MDs telling the patients that I see at least, there is definitely an over-reliance on them saying that weight is a huge factor. Not to say that it's not a factor, but I do think that there is an over-reliance on that being like the core of the issue. Like there's other things going on, like you can't just always blame weight for everything that happens, and it's fine. Like it's fine, whatever. Has your doctor mentioned the next comment? Has your doctor mentioned getting an MRI? It sounds like your cervical and lumbar spine should be checked more thoroughly. I completely agree with you. It's frustrating when they just blame. If you're upset, it's like I'm reading in the future without looking deeper. Yeah, I will say an MRI probably wouldn't be like the most terrible idea. One, I will say that MRIs are probably over-relied on, but when you think about the way MDs are classically trained, and this is obviously a bit of a sweeping statement, and I love MDs, don't take it wrong, but I do think that medical doctors are more prone to using more expensive evaluation tools. MRIs are a fantastic tool, but they use up a lot of energy, and they are very expensive. So if you're getting sent into an MRI, there should be a pretty strong idea that you have something going on that's pinching, and like if you have an actual true pinch, then that should be what an MRI is for. But if you're going sent there just to be like I call it the safari, if you go in there and they're just like, yeah, we're looking for whatever, like an exploratory MRI, I don't know. I don't think that it's a great idea, at least from an from an economy standpoint, because that's just gonna make your insurance pay for it, and then that might home into premiums, and that's another discussion. But unfortunately, I do think that MDs probably over rely on MRIs when you could, like I was talking earlier, if you just say, hey, if you do the limbo, like what is your lumbar range of motion, and if they do a certain movement and it just causes it to like ping off, sometimes you don't necessarily need to know exactly what the problem is, especially when it's a musculoskeletal thing. I do think that if you kind of get a general idea of what's going on, and it's like, oh, this is a range of motion issue that's probably causing a joint to not move smoothly, I say treat it conservatively. Either go to a chiro, go to a physical therapist, and if they do stuff and it feels better, then I think that's probably good enough. Some people are very micromanaging of their care, which is fun, which is good. I definitely advocate for patients to like kind of know what's going on, but there's definitely an over-reliance on sometimes knowing like exactly what's wrong, which again is good and bad in a way. If you know exactly what's wrong, it's easier to prevent, especially in the future. But I don't know. Sometimes people dig a little too hard. I don't know. But yeah, the general sum up of this one, I would say weight is definitely a factor. I don't think it's the factor. There's definitely a lot of other things. Sedentary behavior is probably my go-to. I would say with this person, the first thing I would ask is like, where do you work, right? If you work in a if you work in a factory, you might be more likely to lose your hand in a machine or whatever. But it's not the Gilded Age anymore. But no, if you have a sedentary job, like you work at an office where you work at a computer, that'd be the first thing I would say is probably a cause. Sitting is not great for the low back, and especially if it's going down if it's in the low back and going into the back of the legs. Like I said, there's usually a leg muscle component that I find that when we stretch it out, it immediately starts to feel better. But yeah, you'd have to go to a doctor to get that evaluated. But it's generally my 2 cents on that matter. All right, so the second question that we're going to go over today, again in Reddit, our back pain, is how screwed am I? You got to love it when people come in really dramatic like that. So this is what appears to be a CT scan. This is a CT scan report, as he says down there. So I got a CT scan on my back, having pain for nearly 2 years. I'm only 28. How screwed am I? So kind of referencing back to that previous post, I will say, as a chiropractor, people come to me mostly, for the most part, for pain, because pain is very debilitating. Being in pain sucks. I'm just gonna put it out there. Sorry for the language, but being in pain is not fun. And when you are unable, and the true crux of what I find most of the time when people come to see me is, they're like, "Listen, Dr. D, I'm in pain," and then that's kind of where they stop. And it's my job to ask them, "Well, if you're in pain, what is that stopping you from doing?" Because I find that most of the time people are willing to be in pain as long as it's not stopping them from doing the things that they really like. Whether it's go golfing or whether they go run or whatever it is. And obviously, again, very generally speaking, there are some people who are very like reactive to pain and they are immediately like, "Oh, let me go take care of this." But men especially, I've noticed that if they have a little bit of pain, they're just like, "Yeah, whatever, I'll just live with it." And that's a testament to to how tough people really are. But it's not great for health, because when you have pain, you got to think about what is the cause of, like, why does the body have pain? Pain is not a bad thing, otherwise your body wouldn't do it. The pain is trying to tell you something. And if you have something going on in the low back or wherever, usually it's low back, I'm a chiro, obviously bump into that a lot, but when you have something going on in the low back, the question is well, why is it happening? That's why we like to evaluate things like range of motion or sedentary behavior or what is your diet, because a lot of these will tell you different factors for the pain that you're feeling. And again, it's like, and if you were to, it's these things that add up. And when they all start to add up, that's when you start to get pain. And anyway, the point I'm getting to is, a lot of times pain is a multifaceted thing. If you come in, it's usually not being caused by exactly one thing. Sometimes it is. If you have a fracture, that's, obviously a single, like a single thing you could probably point to. But a lot of times people are looking for a single thing. They're like, "Oh, look at that one thing. That one thing on my CT scan. It's there. Oh my God, that's the cause of all my pain and my frustration." And sometimes it is. And that's kind of the frustrating thing, is sometimes that actually is the answer, but a lot of times it's not. At least that's what I find anyway when the people come to see me. Anyway, so here's an impression. So if you don't know what a CT scan or an X-ray scan report is, the idea is that your physician is going to take a picture of it. They're going to look at it, and then they're going to write down what they see on it. That's what they call a report. And then at the very bottom of it, it's very similar to like a research paper, where they'll have like, "Oh yeah, here's like what we were doing." And then at the bottom of it, there's what they call like a review or a conclusion. And that essentially is what an impression is. And so it's the TLDR, it's the too long didn't read. So if you're just like, I don't know what all this mumbo jumbo means, let me just run down to the impression and see what they saw. So if you just want kind of like a really quick overhead, that's what the impression is for. Anyway, so number one, no acute fracture or malalignment. That's usually one of the first things that's on the impression, just because if you do have a fracture, that's more than likely the cause of an issue. I like to think of the numbers on the impression or conclusions in the order of importance. So if you have a broken bone, that's a lot worse than saying, "Oh, I found like an otolith, like a random extra bone in the human body," or whatever. So obviously a fracture is usually one of the first things. Usually at the very top, there's like your cancers and stuff like that. Stuff that's really life-threatening, that's where you put at the top. So it's usually an order of severity. So no acute fracture and malalignment, that's obviously good. You don't want those things. So it's really important to point those out. If you had a fracture or a malalignment, those are more likely to be the cause of distress in your patient. That's why it's usually up at the top. So if somebody's just looking at it really quickly, like let's just say, I would read the whole thing personally, but if you go to, like, if you send it to another doctor or somebody who's medical related, but maybe not your doctor or whatever, they'll look at it and maybe they'll read the first one and be like, "Okay, there's no fracture. That's good enough for me." And I don't know, toss it over their shoulder or whatever. Which is a shame. People put a lot of work into these things. It's a shame nobody reads the whole things, but whatever. It's important to note that it's just in the order of severity. Just remember that. Usually, anyway. Moderate to severe spondylosis at L3, L4 for the patient's age with associated. That's an important note right there. Age with associated posterior end plate spur and disc protrusion. Disc with a C. A lot of times you see K's when people talk about discs that aren't medical related. So I always laugh. Sometimes I put K, just because I'm a goofball. Protrusion, mild canal stenosis, and moderate bilateral lateral recess stenosis at L3, L4. That's actually a big one. I'm going to come back and hit that one. That's chiro land right there. That's like all that. We love that kind of stuff. Well, we don't love it. We like to read it. We like to on a theoretical level, we love to look at it. Mild spondylosis and disc space narrowing at L2, L3. Stable 11-degree levoscoliosis. Sometimes even I have trouble with these words. Of the lumbar spine. Does reduction techniques utilized for this exam include a lot of... Yeah, there's nothing else on that one. So let's just say that for a chiro, when it comes to something called spondylosis, which spondylosis is like a super fancy term in medical land that means degeneration. It means that something there is not has not been aging well, shall we say. Spondylosis usually means that there is some kind of degenerative change, or the bones are moving in a way that the body's maybe okay with, but it looks really crazy on a X-ray. Spondylosis can mean a whole lot of things. So spondy, I believe, I think it's Latin or Greek for spine, essentially. And losis usually means like condition of, generally speaking, I think, off the top of my head. Again, my Latin and Greek might be a little rusty. But whenever you see spondylosis, it usually means that there's some kind of change in it. Most of the time, that's a spur, which is obviously referenced in this. So the patient's age, which is important to note, because if you have a patient, this one, he says he's 28. So 28-year-olds, if they come in, generally speaking, I noticed that the 30s and 40s is when, or late 30s going into 40s is when the piper comes a calling for people's bad behavior when it comes to spinal hygiene. So 28 is actually pretty young to have like an actual, like, pretty noticeable spondylosis. That means they've been rough. Again, I would ask, what do you do for work? Are you like a construction worker? Are you, whatever, blah, blah. And a lot of times those things will inform you, like the stresses that the back has been going through for their entire life or whatever. So, anyway, so it's important to note that for a patient's age with associated posterior end plate spur and disc protrusion, that might mean that it's a lot less severe than you might see on somebody who's like 80 or whatever. When you get to 80, a lot of times your discs aren't like a huge issue anymore because the disc does shrink as we get older. But yeah, I've seen some crazy spurs, especially as you get older. Because as you get older, your spurs naturally have to get bigger because you lose your disc. That's essentially what aging of the spine is. That's kind of inevitable for all humans. How bad it is up to the lifestyle of the person. But yeah, that's something that is important to note. So, like, anyway, the point I'm getting to is, like, when you look at this person's CT scan, if you were to see it, you might think like, oh, this isn't all that bad, but for a 28-year-old, it might be especially bad. And it goes to show you, it's not necessarily the change itself that is noteworthy. It's the speed at which they got that change. So something to kind of keep in mind. And to me, and again, I don't know this person, but if I were to read this, I'd think like, okay, this person probably has a job where they're putting a lot of demand, especially in L2, L3, L4. That's usually a little higher up. Most of the time, you notice those changes in L5, S1. L5, S1 usually is a lot of bending, I've noticed. When you are higher up in the L spine, it can kind of be a lot of different reasons, and it's hard for me to speculate, but it's good to know. And then right below it, mild spondylosis and disc space narrowing of L2, L3. It's pretty much the exact same thing as the thing above it. It's just the next segment up, which tells you that it's more of a regional problem and not like a specific, like, oh yeah, I got hit by a bat specifically on my L4 or whatever. Yeah, but that just means that this guy's back is starting to degenerate. Now, something that some people, and again, one of the reasons why I like doing this channel is a lot of times, like, medical people like to use these big, like, fancy words, which is important because it's a little bit more descriptive than, like, somebody looking at a back and be like, oh yeah, his back's real bad. He's got bad back. He's got a wicked bad back. Yeah, it's fine. They use those words for a reason because we have to pay. I like to think of it as, oh yeah, I have to prove to everybody why I got my student loans. It's just something that I like to laugh about. But stenosis essentially just means narrowing, or it means you're like losing space. So whenever you see spinal stenosis or canal stenosis, a lot of these words are kind of interchangeable. Sometimes they're very specific and they're specific for a reason, but I notice a lot of times they get used a little bit more interchangeably. So a canal stenosis would mean that in the spinal canal itself, so like with the bones, you have the vertebra going up and down, and inside of the vertebra is the spinal cord, and there's supposed to be a certain amount of space in between the circle where the vertebra goes. Hopefully I have a picture right here. And that picture, or that hole, has a lot of stuff going through it. Because when you look at like an anatomical drawing or a picture of it, you think like, oh, there's just like one thing going through there. No, there's a lot of stuff going through that hole. And if you start to lose space because the bone is growing bigger, that's essentially what a spur is. It's reducing the amount of space in that area. And that's why If the back of the disc is the thing that's turning into bone, the spur, if it's a backwards spur, which most of them tend to be, that's why it's called a posterior end plate spur. When that happens, that canal starts to get narrowed. And when you start having a narrow spinal canal, random things can happen, because there's a lot of stuff that goes through the spinal cord that would be very difficult to speculate on this for sure. But let's just say that when you start to lose space there, you're going to start noticing it when your body starts having a problem with it. Some people have stenosis and they don't really notice all that much of a difference. That's kind of one of the beautiful things about the human body and people's like different pain tolerances and blah, blah, blah. Is sometimes somebody's back can be like the most horrible looking thing you've ever seen. And they just don't, they're like, yeah, you know, whatever. It's another day. It's another Tuesday. So just something to kind of keep in mind. Everybody's impression. Everybody's going to handle these things a lot differently. This guy's been having pain for 2 years, which is pretty brutal. I would be curious to know if an adjustment caused it to feel better. Don't know if this guy's gone to a chiropractor. Didn't mention it. But even if he goes to PT, I think if you strengthen the low back muscles, which is another thing I should say, that I don't think a canal stenosis is what I like to call a death sentence. It's definitely something that is manageable, and you can find a happy place in your life as long as the changes aren't so severe that you have to go through a surgical intervention. That does happen. I might be a chiro, but I'm anti unnecessary surgery. I'm not anti surgery. But I will say that if you have a spine that is so bad that you are not able to do anything, then yeah, I think a surgical intervention might be worth it. Spine surgery is kind of a controversial thing. That's I'd probably have a whole video on that by myself, alone, but I won't get into it here. But spine surgeries, let's just say they're not always successful, but they're definitely warranted if somebody's just not able to function without it. You're not, check out low back ability and keep grinding. Yeah, that's kind of what I was hitting at. Is I don't think that this is a death sentence by any means. I think if you find out what you are lacking lifestyle wise, or like whatever, like some kind of certain movement, maybe you just really want the ability to bend, or like any kind of like if you notice it like going backwards, maybe it's your low back muscles just are not strong enough to keep your spine still. There's a lot of different things that have been causing it, and so it's important to know when you're getting evaluated what is the mechanism. That's gonna be, I'm gonna have to put that on a shirt at some point. It's like, what is the mechanism of pain? Next commenter, I have like 6 herniated discs, brutal, and stenosis and pars defects, brutal. Your spine wears down over time, especially if you're active. It's normal, right? As I was getting to that. Your body adjusts and stops feeling the pain if you do the right exercise routine. Exactly. Definitely don't avoid movement. Yeah, that is one of the most key. I keep interrupting, sorry, but yeah, that is like super important. If you're in pain, the worst thing you could do is totally giving up on movement, because then the pain is definitely not going to get better. You have to, obviously give yourself time to rest. Like, don't always be moving for sure. But I do think it's important for people to realize that if you're in pain, it doesn't mean you're going to be bedridden for the rest of your life. You got to get up and move. It's not moving is not going to make it any better. Just put it that way. S takes a long time though. Yeah, it can. Definitely don't get surgery, and definitely don't take most people's advice on Reddit. Yeah, it's going to freak you out. You need to get to the point where you can start doing light back exercises and slowly train your back strength up again so you don't get injured again. Yeah, I couldn't agree more. I do think that people are a little excited on the trigger, shall we say, to go straight to like, oh yeah, I got to have a knife. You got to knife it out. Like I said, it's warranted at times as a medical professional. I can truly say sometimes you do need to go for the hip replacement, or sometimes you got to go for the knee replacement. And if you go to a chiropractor, it's a good way to manage that stuff until like the very last minute. To the point where you're just like, yeah, there's like, it doesn't matter what I do now, no matter what I do, I can't function. And I think, in my opinion, that as a chiropractor, it's not always, again, about pain. It's not always about like necessarily focusing on pain. It's about focusing on like, what is it that this person wants to do? If they like to go golfing, well then let's keep it functioning as long as possible until you just can't golf anymore, and then we'll talk about going under the knife. I like playing, they'll be like, I like playing with my grandkids, and I like to bend over and get on the ground with them and play tummy time or whatever. That's an important, that I find is the most important thing. And I think doctors sometimes forget that because of because like, you don't know what you don't know. And like for me, I don't want to push my personal values on somebody. So like to me, I would be upset if I can't bend over and like touch my toes or whatever. But like that's like a personal achievement, I guess. Like, it's fine. It's not a problem. If that's like, if they don't find that valuable, then that's fine. But if you want to be able to play with your kid on the ground or whatever, and you're having trouble getting down or up, well, that's a good way to gauge if you're able to do that or not. But it's not necessarily that achievement in itself that's important. It's the person's perceived ability to be able to get down and play with their kids or whatever. Anyway, too long didn't read. My impression, shall we say, of everything I just said is like, you just have to evaluate what the mechanism of pain is, and then figure out what it is that they want. What is their goal? That's a long-winded way of saying they should have a goal. What is it they want to do? And then you help them get to that goal. And then after that, then you can start talking about like, oh yeah, hey, let's talk about future goals or whatever. And that might be, increased hamstring stretchiness or whatever it might be. So just kind of, an important thing to kind of think about. But anyway, yeah, so I figured, I would do that. There's a couple Reddit cases. If you guys have any cases or again, not necessarily cases, but if you have any like Reddit things that you've seen that you would kind of have some interest in me answering or at least talking about, then send it to me. Go ahead and talk down in the comments. If you have any questions or anything, I'll try and keep my eyes open on them. And other than that, yeah, thanks for coming. Keep it popping out there, and I hope you have a beautiful day, you big, beautiful person, you.